Drowning remains the second leading cause of unintentional injury-related death for children ages 1 to 14. Dr. Paul Lubinsky and Michelle Lubahn, the Health and Wellness Coordinator of Children's Hospital of Orange County, share their insights.
The vast majority of drownings that we deal with are actually pool drownings in the 1 to 4-year-old age group. This is the leading cause of death in the 1 to 4-year-old age group, accidental death. And the reason for that is that when you go to the beach with little Johnny, you're worried he's going to run away, the wave's going to knock him over, and somebody's watching. And that's the only real difference. We see very few saltwater drownings here, despite the fact that we live at the coast. And those tend to occur more in adolescence. Little Johnny doesn't drown at the beach. Little Johnny drowns in the backyard pool, the spa, sometimes the bathtub or a bucket of water. Those kids who can actually get CPR, be resuscitated at the scene, we will tell the parents that those kids are going to survive. We can save them from the respiratory illness that they develop from this, but we can't reverse the neurologic complications. And if you've had a prolonged enough period under the water that you've had a cardiac arrest as a child, then you've started to suffer brain damage. If you can be resuscitated at the scene, then you haven't been down that long. It's the kid who arrives in the emergency room that still requires CPR that's going to have a very bad outcome. When kids drown, as I said, there's a prolonged period of hypoxia and acidosis before their heart stops. Kids' hearts can actually beat for a long time without breathing. By the time your heart stops, it means that your brain's starting to suffer lack of oxygen and damage. And it's the thinking area of the brain that's damaged. It's the surface of the brain, what we call the cortex. So, and that doesn't recover like other organs can. By far the best thing you can do is to prevent the child from ever getting in the water. And that's really the theme where I want to go, is that prevention is key here.
CHOC Children's has a water safety program through the generous support of Kohl's department stores, and we provide these water watcher tags free of charge to the community. And what they are is just a reminder for parents. They put this tag on and they're supervising the children in and around the water. So for a period of time, their eyes are just on those kiddos in the water. They're not supposed to be doing child wrangling, talking on the phone, reading a book, drinking alcohol. They're just going to be watching the children in the pool. And that's just to make sure that there's always a set of eyes on the children. A lot of times when we get multiple families together, people start talking or doing something, everyone assumes somebody else is watching the children, and then no one is. And that's when we see drownings occur. So the water watcher tag is a reminder for parents to keep their eyes on the children. It's also good for the children to learn and watch that they have someone always supervising them in and around the water. So when a person purchases a home with a swimming pool, there's a few things they should think about, especially if they have small children. First, access to the pool. We want to make sure that we eliminate as much access as we can to the pool. Having a four-sided isolation fence around the pool is going to be key. So along with the isolation fence, I would recommend your other barriers. So having an alarm system that will alert you the second your child tries to get out of that door. You can also put pool covers after you have your isolation fence in place. So you see how we're building the layers, and each one the child's going to have to manipulate and learn so that they can buy you some time to figure out where your child went to. So one thing I think parents need to be careful about, especially if they have a pool or spa, is that water wings and flotation devices are toys. They are not life-saving. So if we think about them as toys, then we know that there's still a risk when those kids are wearing the water wings. The other thing I would remind parents is that no one is drown-proof. You and I, we could be the best swimmers in the world, and something can happen to us in water. We need to respect the water. We should never swim alone, even when we're fully grown. We always tell the kids that. You want to be careful because you can have a heart attack, you can have a seizure, something can happen to you in water, and water's unforgiving if something like that happens and you're by yourself. So no one should ever swim alone. No one is drown-proof.